not going to go where when we dorsiflex it? It's right. It's not going to go up under the tibia. Under what's the name of that joint? Anybody remember? Mortise joint. That's right. And if you're having trouble with it coming this way, that means it's gone posterior. Okay? So you're going to motion it back and forth. Okay? You can have a little bit of inversion, eversion to help you to determine if the bone has come anterior, you go anterior. Okay? Motion palpate the navicular. You're going to come across here. You're going to stabilize in on the talus. Grab the navicular, and you'll be underneath the foot and on top of the foot, and you're going to move the navicular up and down, stabilizing the talus. You can move down, grab onto the navicular so that you can do the first cuneiform like this, or you can do the navicular like this and move this up and down. Come down to the second one and the third one. It's all basically the same motion. Just make sure you're on the correct one. When you're doing the fifth metatarsal head, the proximal fifth metatarsal head, you'll just go like this, stabilizing with your thumb in here on the cuboid, which is just past this this fifth metatarsal head, this proximal fifth metatarsal head. This indentation is where you're going to find the cuboid, and in order to motion palpate the cuboid, you can have the patient lean away from you a little bit, stabilize on the calcaneus, grab the cuboid here, and you're going to move it up and down. Okay? You can see I'm on top of the foot and I'm underneath the foot pushing the calcaneus. You're going to stabilize in here on the talus as much as you can, and you're going to move it in a figure eight passage. Trying to figure out where the restrictions are. Okay, so everybody have that? If you're going to be motion palpating the distal metatarsal heads, just move out like this and just push them up. And remember, you're doing the distal metatarsal heads are what you're motioning. Okay, if you're going to motion it for an inversion sprain, you can have your patient roll away a little bit. And you're going to come out under the calcaneus with these fingers. Your thumb's going to go over top of the base of the talus. Your thenar is on top of it, and you're just motioning it. Very, very similar in the fashion as when you're doing this, except now you're getting the calcaneus involved. If you're going to adjust for an inversion sprain, it's the same mechanism. The only thing you're going to do is you're going to take out the traction, and you're going to thrust everything back up underneath the mortise joint. And I'm also pulling on the calcaneus when I'm doing this, and it's a distraction and it's a thrust at the same time. This way, okay? The talus, you can have the patient move. Let's get you all the way. Let's turn this around. Foot hang on. Here. Just like this. Chiropractic index finger. Make sure you're all the way up on the talus. You don't want to be down here on the cuboid and the navicular. Take out your slack, and you're going to traction and thrust down, just like with an AS occiput. If it's gone medial, you're going to add a little bit of inversion. If it's gone lateral, you'll add a little bit of eversion and thrust it under. Okay? Everybody got that? While we have them here, you're going to do the calcaneus that's gone anterior and medial. We're going to stabilize in here as much as we can onto the talus, and we're going to just thrust that back and under, and you're going to torque it this way. If it's gone lateral, it's the exact opposite. Under, just like that. Okay. Okay. The navicular, come up right under here with your thenar, right underneath the navicular. You're not on the edge of the navicular, you come up underneath of it. This hand is on the top of the foot. Most of the time when you're adjusting these, your hand is on top this way. Don't grab it like this, and then you're going to thrust it up. Same with the first cuneiform, you can do that this way as well. Add some inversion with your plantar flexion. Okay, so it's both of those. Everybody got that? You can also, I'm going to have you lay face down. Oh, okay, we're going to have to move this down. Watch your face. Okay, first, second, third cuneiform. You can do the first one. You can do the first one like this or the other way. Okay, but the second and the third one is definitely done like this. So you make sure you're on the right bone. And take the patient's foot and just thrust it through. You're going to be opening the joint at the front with these fingers. Everybody see that? I want to make sure that you're doing that on your test. It gives it a place to go. If you put the patient's foot into some plantar flexion, that's fine as well. Okay. Let me have you sit up again, please. Oh, I'm sorry, I should have left you there. We'll finish the calcaneus. Scoot up just a little bit if you would, please. There you go. On this one, for the calcaneus, we're going to be stabilizing the proximal, or the distal fibula and the tibia, and you're going to be thrusting it down. If it's gone straight posterior, if it's gone posterior medial, you'll torque it this way, because the joint's open on the side. If it's gone posterior lateral, you torque it the other way. Whichever hand you use is not all that important. And you can remember, if you're ever going to do a posterior talus, use your medial hand and thrust down. Okay. It's not going to be on the test, just a reminder. Now we'll have you sit up, sir. If you're going to do the cuboid, have the patient lean away from you a little bit, please. Bring your hand up just like this. You're sort of grabbing onto the calcaneus, you can see here. I'm taking my thenar right up on the cuboid. This time I'm again holding onto the dorsum of the foot this way, and I'm going to plantar flex, and now I'm going to evert it. I'm going to shove it back up. And if you're doing one of these here, remember you're just going to grab it, and you're going to traction and lift. Each individual one, whatever it is, traction, lift. Okay? You can also do this first one this way. Come up here with your femur, hold this way. The rest of it. Okay. Have we finished them all? Okay, ladies and gentlemen, practice whatever.